the management of patients with the mental illness, right? And so you have presented several cases, and you might have discussed the management. But in the exam, a long case, or when you are become a doctor, how you would approach a patient in the management, right? In psychiatry, basically we manage the patients in front of you, or else we do personalized management, right? So our management has to be very much personalized to the patient, right? For this personalized management, we gather information, as we discussed, from the history, right? So history, we take a detailed history to come to a diagnosis, and other most important thing is we gather information for the management, right? So for example, if you have you need to gather information which are useful for the management, right? You need to gather information to choose a medication, right? You need to gather information just to see how to ensure the compliance, right? And you need to gather information, the possible ways of rehabilitation, the possible ways of continuation of treatment, right? So where do you refer patients? And you need to get the information to manage the patient's medical comorbidities, right? You need to get the information to be able to manage the psychological needs of patient. And you need to get the information to manage the social aspect of the patient as well, right? So this is when you manage a patient, the first thing is the personalized management, right? For the personalized management, you need to get the information from several sources. The first thing is in the history, right? So how else you can gather? What are the other ways of gathering information for the management? Now you have a patient in front of you. So what you have taken detailed history. So how do you gather information for the management? What are the resources you have to manage the patient? What other resources you have?
Past records, sir.
Very good. Past records, right? The past records are very useful information, right? So sometimes you might not have all the details if patient has had a kind of a mental illness for like 20 years or so, and the patient may not remember everything, the family may not remember everything, but in the records, things have been documented very clearly, right? So why the patient admitted, what was the decreased severity, and for what medication patient improved, and for what medication patient developed side effects, and what are the major challenges in the management, right? And what were the risks, and what were the medical risks, and things like that, right? So past records are something really important. So in the exam, when you do the management, it is really important to show that you are keen to kind of trace the past records, right? So when you have a patient with a mental illness or long-standing illness, so when patient admitted, so in the board, we need to kind of trace the past records. If you do not have information, or if you are kind of a concern about a particular the information, so you need to records, right? Or else these records need to be traced, and the patient might have clinic books with the patient, right? So you can get the clinic books from the clinic, right? And you can gather past admission records from the record room. Okay. So that is something, a very useful source of information for the management, right? So sometimes more than the management, to establish the diagnosis. Sometimes after the history and mental state examination, you have a set of differential diagnosis, right? you have a set of differential diagnoses. You don't know whether this is schizophrenia or schizoaffective disorder or organic psychotic disorder, something like that. Then you need to trace mass records to establish the diagnosis before you start the proper management, right? So when you have a set of differential diagnoses in the exam, so it is really important for you to tell examiners that you are keen to establish a definitive diagnosis. For that, you might need past records, so you might need other sources of information. Okay, right. Past record is one. What are the other sources of information?
Sir, we can take a collateral history, sir,
From whom?
from the guardian or the parent.
Yeah, you can get collateral information from the family, right? So it is really important to kind of get collateral information most of the time, right? So you are not totally dependent on the collateral information, but you need to get collateral informations, right? So that is also part of the management, right? You need to get collateral information just to make sure whether you have the all the informations with you. So before you plan the management, you need to have all the informations. So what kind of information you would get from the collateral information or family or guardian?
Sir, regarding past psychiatric history and the personal history.
Like what? Specifically?
How many relapses occur and what kind of treatment patient has received, whether ECT was given.
Okay. So yeah, okay, right. So those things and the patient's level of functioning, right? And about the risk and things like that, right? So you can't just say, so in the exam, this is very important. You can't just say, I get collateral informations, right? So in the exam, you present history and mental state examination, right? So at the end of the presentation, you might have few things to clarify, right? You might have few things to clarify, right? So you need to have that information with you, what kind of specific questions I would ask, right? Otherwise, if you just say that I would get collateral information, it doesn't carry any marks, right? You need to say, I talk to the family to clarify this information, to further get this type of information, his functional level, what he does at home, and what are the risks involved, and what kind of behavior was it, and how distressful his behavioral change or illness to the family, and things like that. How he is interacting with the family members and things like that, right? So whatever the information, his compliance to medication and whatever the information you need to specifically tell in the exam. So I would talk to the family members to gather this kind of information, right? Okay, right. So what are the other sources of information? So if patient brought by the police or referred by the courts, right, then you can get some information from the police or courts, right? And so from the police, from the time patient kind of get into the police custody and to the point patient brought to the psychiatry unit, right? So you can get some information from the police, the kind of what was the kind of abnormalities you have observed at the time of you take him to custody and things like that. And what was the presentation and reason why you are keeping him in the police and things like that. Okay. And so likewise, the other one is the medical boards, right? If patient is referred from medical board, if, for example, medical team thinks that he's having a psychotic illness, right? So you can talk to the nursing officers on the board. You can talk to the doctors on the board, right? And if you first you need to take a detailed history and mental state examination and everything, then you need to have set of specific questions to ask from them, right? Then you can clarify. For example, if you have a patient with behavioral change, if you think it's possible delirium, then the patient might not remember all the information. Then you can kind of talk to the ward staff, nursing staff and the doctors, what were the abnormalities you observed on the ward, kind of things, right? So that in the management, collateral information is something very, very important. Okay, right. So what are the what else you would do in the management? How to personalize the management? How do you personalize the management? What are the information you need to personalize the management? What are the information you need to personalize management? So you need to clarify the diagnosis, okay? You need to have some collateral information and so on. And you get the information from the history. Yeah.
Risk assessment, sir.
Yeah, okay, from the risk assessment. So that is what you assess, right? If patient. So how does risk assessment help to personalize the management?
If the patient is having high suicidal risk, we have to admit we have
Very
to
good.
inform the nurses and have a good and safe environment at the ward.
Yeah, very good. Yeah. So in the ward, you need to kind of if patient is having a high risk of suicide, then you can decide the management setting, right? Then you can decide the management setting. So if patient is having high suicide or homicide risk or whatever the risk affect individual or other safety, then you need to admit the patient. So you can decide the management setting based on the risk. And based on the risk, you might have to inform the hospital staff, the nursing staff. Patient is having high suicide risk, then you can inform nursing staff to keep an eye on one-to-one care, right? So if patient goes to the washroom and wherever, so you need to kind of have a constant supervision for suicide risk. And on the board, the hanging points and the sharp objects and things like that has to be removed, right? So that is something really important. Okay, right. So what else? To personalize the management.
So the medical comorbidities that the patient is having?
Yeah. The medical comorbidities you need to kind of address. And so if patient is having medical comorbidities, so that is important in choosing the medication, and you need to do the liaison psychiatry. You need to do appropriate referrals and things like that. Okay. Anything else?
So we can do the investigations for exclude metabolic diseases like
Very good. Yeah.
start.
Yeah. Investigations are also important for the personalized management, right? For example, if patient is before starting clozapine, you do ECG and 2D echo. And if they are not favorable, you might not be able to start clozapine, right? So those are important. Yeah. Okay, if patient is, you do renal functions, if patient is having renal failure or compromised renal function or compromised liver function, you might not be able to start the standard medication dose, right? Yeah. Anything else?
So, the support system that patient is having.
Very good. Very good. That is something very important. The support system patient is having, right? So based on the support system patient is having, so our management changes, right? So for example, if patient can't afford medication outside, sometimes the patient, patient is obese and having metabolic risk factors, you might want to start a medication which does not cause, or lesser propensity to cause metabolic syndrome like aripiprazole if it is not available in the hospital. If patient can't afford, you can't do that, right? If patient is having depression and fairly suicide risk with each relapse, if patient is living alone, so you are concerned, you have a concern at the time of discharge, right? If patient is having dementia or resistant schizophrenia, symptoms are not responding, the family support and things like that, there really matters a lot, social. And if patient is having severe psychiatric illness, having comorbid substance use and things like that, if patient coming from the community where substance use is highly prevalent, right? So you need to take that into the consideration in the management, okay? And how long patient is coming from, right? So where you refer patients for the continuation of care, right? And especially for the risk management and things like that, those things are very important. The social information, social investigations. So if you do not have all the informations, you need to tell specifically to the psychiatric social worker to find this information. For example, patient safety and things like that. Okay, right. So if, for example, if patient is having not having a safe place to live, if you can't assure the patient's safety at home and things like that, you can discuss with the psychiatric social worker to find the placement for the patient, right? To assure the safety, right? So likewise, it is really important to gather information to personalize the management, right? And pharmacological management, you know that, so for each condition, it is really important to manage the acute phase and the maintenance treatment to prevent the relapse. Depression, schizophrenia, bipolar disorder, whatever, the pharmacological management, there are two kinds, the acute management and the maintenance treatment, right? So how do you decide the dose? You do the serial mental state examination. And so based on the finding, you increase or decrease the dose and things like that. And you need to continue the medication. The most important thing is when you continue the medication, you need to monitor the patient for improvement, side effect, and quality of life, right? So those are very important. You need to, when you see the patient during the follow-up sessions, okay? And always, when patient admitted, you need to do a mental state examination and you need to do a risk assessment, and both has to be documented, right? If patient harm himself on the day 4 of admission, right? If you do not have the risk assessment on that day or day before, so you are at trouble, right? So you need to say that I will daily assess the patient and document the symptoms and the risk assessment and important other findings as well, right? So continuous monitoring of symptoms and the risk or emergence of side effects to the medication are something really important, okay? And in not only the pharmacological management, then, for example, patients with severe mental illness, if patient needs rehabilitation, you need to do a functional assessment with the occupational therapist, right? So then you discuss with the occupational therapist about the functional deficits, and then you need to be able to advise the occupational therapist for the particular rehabilitation. And initially on the board, early we start rehabilitation, residential rehabilitation. Then once we discharge the patient, then in the history, we need to have some idea about what are the activities patient can do at home, whether patient is cooking or cleaning or do farming or whatever the job. And all these things provide a very good opportunity for rehabilitation and socialize the patient, right? So you need to, in the history, you need to have all these informations, right? To manage the patient, rehabilitate in the community. Okay, so that is also something really important. Another important thing is psychological management is this big part is the psychoeducation, right? So we discuss in the Moki, and you need to be able to give information about the illness, give information about the outcome, give information about the medication, right? So all those things, the psychoeducation is something very, very important. Psychoeducation is not just a one-off thing, right? So you do psychoeducation at the time of admissions and in the middle of the admission and at the time of discharge. And you might have to give several sessions of psychoeducation during the follow-up as well, because in one-off psychoeducation doesn't help much. Patient may not be or family may not be able to understand what it is, what is the mental illness or something like that. Okay. Right. And so it is really important to give a discharge plan, right? So you can't just say discharge, right? So at the time of discharge, what you would do, right? So what are the social support you have got? And so what is the outcome of the illness? On what criteria you would decide the discharge? And what are the medications you are giving? How you arrange the continuation of care, right? So you need to educate the patient about, again, the illness, medication, and relapse signature. And if patient experience symptoms, what the family members need to do, right? So all those things has to be monitored, right? All of the information has to be given properly. And so during the follow-up, so you need to know what are the things you would do during the follow-up as well. All right. And those are some of the very important aspects. You need to do personalized management, biological, psychological, and social management. So you are doing the management not by yourself, right? With the multidisciplinary team. You need to know all the members of multidisciplinary team and what are the role of each members of the multidisciplinary team. In psychiatry, we manage patient in the ward setting and in the community. You need to have some idea about how you manage the patient in the community. Who are the members of multidisciplinary team working in the community, right? So who are the members of multidisciplinary team looking after patient in the community?
The psychiatric social worker.
Okay. More than that?
Community psychiatric nurse.
Very good. Community psychiatric nurse, right? Community psychiatric nurse is the one who do home visits and do assessment at the home, right? So like that, in the management, so it is not just what the textbook say, right? If you come and say what the textbook say in the exam, you don't get marks, right? So management of patients with mental illness is what I described. So I described the basic sketch, right? So you need to be able to fit this sketch with your patient, right? You need to fill this sketch with detailed management steps. All right. Any questions? Any questions? Okay. Good night.
Thank you, sir. Good night.
Okay. Good night.